students, this is Joyce Chenard filling in today. We're going to go over how to take a blood sugar. So going to our PowerPoint, we are going to check a blood sugar. This is a review of chapter 52 in ATI. The goal of this video is to go over how to check a blood sugar, how to check sugar in a urine sample, and then also factors that can increase blood sugar, which hint, it isn't always diabetes. So with our glucose readings in the hospital, anytime you see POC, that means point of care. So that would be a bedside test. So anytime you see POC, that means we're going to do that test at the bedside. And often we do glucose readings at the bedside with our patients. This is an example of a hospital meter. I want to point out Accu-Check is a brand. It's a company that makes glucose reading machines. They make them for the hospital and they also make them for home. Hospital meters are generally larger. We do have to input a lot more information into them, such as patient identification, the lot number and expiration date of the strips. It ensures that controls have been run in the past 24 hours, and we'll go over controls a little bit more in soon. This is an example of a home meter. Home meters are generally smaller. They're very straightforward, easy to use. You don't have to input information such as the patient identification number. And if you look down here, this one only has 2 buttons. This one's also made by the company Accu-Check. We're not going to go over today how to run a continuous glucose monitoring system, also known as a CGM, but just be aware, if you see this on your patient, that is what this sensor is. These sensors, they read the patient's glucose continuously. These sensors are usually changed out every other week, and they will sync up either to a meter or to their phone. The nice thing about this is patients can set alarms on them, so if their blood sugar starts to go low or like below 50 or below 60, it can alarm, and the patient can get something to eat or drink. Okay, students, so what do we need to take a blood sugar? Well, we need gloves, because anytime we handle blood products, we do need gloves. We need an alcohol wipe, lancet, cotton ball, and some strips. And I just want to point out that the strips have to match. So if I'm using an Accu-Check meter, then I need to use Accu-Check strips. If I'm using a one-touch meter, I need to use one-touch brand strips. You can't use like Accu-Check strips with a one-touch meter or McKesson meter with Accu-Check strips. They won't work. They're not compatible. So how do we know if our reading is accurate? So in the hospital, every 24 hours, our machines require us, no matter the brand, Accu-Check, One Touch, McKesson, etc. It requires us to do controls. So it's as if we're doing a blood sugar, but we're using what I like to call fake sugar in the little bottle. And we're going to run that test and make sure that the meter is running it correctly. So for example, the level 1, this would be a low blood sugar reading, or it would be a low amount of glucose. So when I do that test, I would expect the machine to read that reading like 60 or under, and then I know it's reading it accurately. Then I would also do the high control. So I would give it this, and I would expect that to be a higher reading. Generally on the label, it will tell you the ranges that this should read. Now if I do a control on it and I'm using the low control or low pretend sugar, and I'm expecting a low reading, and it gives me a reading of 300, then I know my machine isn't reading accurately. So then we have to call Biomed. Once these bottles are open, they're only good for 90 days, and then obviously we can't use them if they're expired. So we touched on this a little bit already. So say you're doing a control test on your meter, and you want to see if it's accurate, and it doesn't give you a correct reading. Well, then it fails. So now every blood sugar is considered null and void since the last time it passed the control check, because we don't know when that meter started to read incorrectly. If it reads the controls incorrectly, you cannot trust that it's reading your patient's blood sugar correctly. So we're going to come over here, and I'm going to check my blood sugar and show you how to do that. So we always need our supplies. As we talked about earlier, we need our strips, we need our meter, the brands have to match, we need our lancets, we need an alcohol wipe, we need a cotton ball. I don't have cotton balls, I have this. Your So in the hospital, our lancets are single use only. They're in these little pre-filled things that you take off the tip and then you use. Your patient's home lancets are usually a little bit different. They usually come in bags like this that has a lot of little needles in them, and then they go into a reusable kind of sticker like this. And so you load it in, and then this covers the needle, so we twist it off. So you may need to know this because you might have to teach your patients how to check their blood sugar with their home meter before they go home, especially if they're a new diabetic. Then we're gonna put this on. So after I've put my needle in here, and it tells, you know, there's a little arrow. They're pretty straightforward on how to do. So I put that together. And then students, just so you know, you probably can't see on the camera, you can adjust how deep you want that needle to go in your patient. So for your patients who maybe have, you know, worked outside and they've used their hand, maybe work construction, and they have a lot of calluses, you're going to have that needle poke them a little bit deeper. Whereas if you have somebody who's older or maybe doesn't have a lot of calluses on their hands, you can adjust it. That's why I really like these. You can adjust it so that it doesn't prick it as deep. So this is usually a lot more comfortable for patients to use, the home ones. All right. At home, for when patients take their blood sugar at home, we tell them just to wash their hands with soap and water. In the hospital, we actually use an alcohol wipe just because we're in the hospital. There's a lot more infections in the hospital, so we want to be careful. And I point that out because patients like to sometimes use that hand sanitizer because in the hospital, their finger was wiped with alcohol. And so at home, they'll use hand sanitizer, alcohol hand sanitizer, before taking their blood sugar. That's a terrible idea. Alcohol will artificially lower your blood sugar reading. So it really interferes with our tests. So we don't want to have our patients use hand sanitizer at home. And then also when we use alcohol in the hospital to check our patient's blood sugar, we want to make sure that that alcohol is completely dry before we go to get our sample, okay? So obviously I would have gloves on if I was taking somebody's blood sugar, but since this is my own, we won't worry about it. So we take our alcohol wipe and we choose our finger and we wipe it off. And then you wait for the alcohol to dry. Don't wave at it, don't blow on it, just let it completely dry, okay? And then once it's dry, you're gonna turn on your meter. Your meter will tell you when it's ready to have the strip inserted. Your strip only goes in one way. There's one end to go in the meter and one end that will accept your sample. So once the meter tells me that it's ready for me to insert the strip, I will do that. And then we have to wait a little bit, and then it will tell me that it's ready for the sample to be applied. My alcohol is completely dry now, so now we're going to get our sample. The first drop of blood, I want you to wipe it away because it might have some alcohol residue, and remember that lowers your blood sugar. So with your sample, if you're having a hard time getting your patient's blood out, don't raise their arm up more because you're not going to have better perfusion. Putting their hand in more of a dependent position will help, and then you can kind of milk it. Now, when I go to apply my sample, I'm not going to rub it on there anywhere. I'm not going to poke it all crazy. I just want you to put it really close and let the machine and the strip pull its sample. So you're just going to gently kind of put it there, and the machine will tell you when it has enough sample. Oops. There we go. Wonderful. Got my blood sugar. And remember, your normal blood sugar is 70 to 110. Okay? 70 to 110. Usually in the hospital, we start to treat them with sliding scale insulin if it's above 150. That's most hospitals. All right, and so then I would dispose of this properly, and I would dispose of my lancet. Now, if I was doing controls, sometimes if you haven't seen this, this is kind of hard to understand. So I only have one control bottle, and this is a normal, it's supposed to be a normal blood sugar, okay? So what I'm gonna do is I'm gonna turn my machine on just like I would check a blood sugar. I'm gonna wait for the machine to tell me when it's ready to accept my strip. shut it back off and turn it back on. All right, so I've got this on. Here we go. And now it's ready for me to apply my sample, but instead of checking my blood sugar again, I am going to apply my control or my fake sugar. And we're just going to gently put a little bit on here. There we go. And then it gave me a reading of 136. So this is considered normal because on my packaging it says 70 to 150 is what is considered normal. Okay, these are good. These drops are good for 90 days once they're opened. And of course you would have to watch for the expiration date because you can't use them when they're expired. Same with your strips. Your strips will always have an expiration date on them. You can't use them when they're expired. Okay, so we're going to get rid of that. Turn that off. All right, let's go back over to our PowerPoint. So if you can test for sugar in the urine, why not use that? Because as you know, we always like to use the most non-invasive methods with our patients. Checking a patient's sugar level with their urine, it's not invasive, but it just isn't that accurate. Your blood sugar, it only starts to read in your urine if your blood sugar is above 220. So with the poor accuracy, we really don't use that. However, we do like to point this out, and it's good to know because if a patient comes in for a different reason, and say we're checking their urine for a UTI, for an infection, and we incidentally notice that they've got sugar in their urine, then we can address that and talk to the provider. So how this works is your kidneys always reabsorb your sugar back into your bloodstream in the tubules. Unless your blood sugar level is above 220, then your kidney isn't able to reabsorb it, and it tries to help, and it disposes that sugar, so you can pee it out. So what is a dipstick? Sometimes we call it a dipstick, sometimes we call it a urinalysis. These terms are often used interchangeably. So we get our patient's urine sample, and then this test can either be read by machine or read manually. It is a cheap and easy, quick 1-minute test that tests for quite a variety of things. We'll come down here. So this would be a test strip. I would take this strip, I would place it in my urine sample, and then I would blot it on a paper towel so that it's not soaking wet. And then I would wait 1 minute, and then I would read it. And so I would compare it to this chart right here. Now this chart is generally on the package that the strips come in. So like I would be checking for leukocytes here where it says LEU. This is for nitrates. So this is something I would use if I was looking for a UTI on my patient. Urobilinogen, this can be with infection or liver issues. Protein, some of you know by now we are not supposed to have protein in our urine. Protein in the urine can be a sign of uncontrolled hypertension or damage from uncontrolled diabetes. Then we can check for blood, and all the way down here at the bottom, this GLU, that is for glucose. So looking at our patient strip right here, if it was negative, so this is the normals right here, if it was negative for sugar in the urine, it would be a light blue color. And the more sugar that's in the urine, the darker it gets. So I know that this patient sample has got a lot of glucose in the urine because of how dark it is. So I would definitely address that with the patient and the provider and go from there. So this is if you read the strip manually, you compare it to the chart. A lot of clinics and obviously in the hospital, they have what is called a urinalysis machine. And so you will take your sample. We would bring the sample over to the lab, obviously with the label on the sample, and then the lab would take a strip and dip it in the urine, blot it off, and they would place it in this machine, and they would hit this button right up here where it says strip test. They would hit this machine, and after 1 minute, the machine will read it, and it will give you this lovely little printout right here and tell you how much sugar, if there's white blood cells, if there's nitrates, and things like that. And then also, side note, whatever brand of strip you have, like this is from Siemens, it has to be on a Siemens machine. There are other brands like McKesson and things. So your strips, just like when you take your blood sugar, your strips brand have to match the machine brand. Otherwise, they don't read. So health conditions that can raise your blood sugar. First and foremost, we know it's diabetes, but also pancreatitis can do that. And if you think about it, students, your pancreas releases insulin. So if your pancreas is sick, either with cancer or inflammation or something like that, it's also going to affect the amount of insulin that you can excrete. Cushing's syndrome. Now, we don't see this very often. It's not a common condition, but it has to do with your adrenal glands, and it has a lot to do with cortisol levels in your body. And cortisol levels raise your blood sugar. And then also hypothyroidism and liver disease. There are medications that also raise your blood sugar. So steroids, sometimes called corticosteroids, it's not a matter of if, but when it raises your blood sugar. And then we also have beta blockers. And if you stop and think about it, we give beta blockers for your heart. It blocks the beta cells in your heart to a certain degree so that your heart doesn't work as hard, and it lowers your blood sugar or blood pressure, and it also lowers your heart rate. But sometimes there's some like cross sensitivity, and so we'll give beta blockers for the heart, but then it'll cross over and affect the beta cells in the pancreas, and the patients sometimes they don't release as much insulin. So if your patient is newly started on a beta blocker, they may later need their diabetes medications adjusted. There are some antipsychotics, like your second generation antipsychotics like risperidone, that can affect blood sugar a little bit. And then parental nutrition. You guys have to know parental nutrition will affect your patient's blood sugar. So I have a picture here. This yellow bag, this is parental nutrition. And what I mean by that is your patient cannot have anything, not only by mouth, but they can't have anything in their GI tract. So for whatever reason, this patient, like they can't use their GI tract. So we're giving them all of their nutrition through the IV. It's called total parental nutrition. This is a very hypertonic solution. We only give it through a central line. And the reason why I'm mentioning it now is this is 25% sugar. 25%. So this whole bag right here, 25% of it is glucose. So anytime your patients are on here, on this total parental nutrition, the standard of care is to check their blood sugars at least 4 times a day. So since your patient isn't eating, we're not doing it before meals, we're doing it literally 4 times a day. So every 6 hours, your patient will have their blood sugar taken. And then also, students, I want you to understand that when patients have been on this for a long time and then it's discontinued, now they can have oral or enteral feedings again. We check their blood sugar for a few days afterwards just to make sure it evens out. Sometimes your patients, when this is discontinued, they'll have hypoglycemia issues. Their pancreas hasn't figured out that they're not getting a ton of sugar through the IV anymore, and it's still churning out a lot of insulin. So these patients, AccuChecks 4 times a day or every 6 hours, and then we watch their blood sugars for a while afterwards when it's discontinued. And then this is lipids. A lot of times we'll give these together. This is usually over a 4-hour infusion. Also, students, with this having such a high sugar content, we always change this bag every 24 hours, and the tubing has to get changed every 24 hours. High risk for infection because of the glucose count. And then also Solumedrol. We give this very commonly, IV push in the hospital for a lot of inflammatory conditions, especially COPD and pneumonia and asthma. This is a steroid similar to prednisone. Some of you may have been on an oral medication called prednisone. This raises blood sugar. So just know if your patient's on this, they may not be diabetic, but if they're getting high doses of this, oftentimes we'll be checking their blood sugar as well. So hopefully this was a good review for you. If you have any questions, feel free to email me on how to take a blood sugar, sugar in the urine, and factors that can increase blood sugar. Thank you.